Hello, Namaskar, good evening. Welcome to NCERT's live interaction. This is Simran Singh. And you all are watching us on PM eVidya channel number 6 to 12, or you might also connect with us to our YouTube channel that you all are well aware of. It is NCERT official. It's around 5 PM on your watch, and here is the time for our special session, that is SAHYOG, regarding enhancing mental well-being and providing psychosocial support to all our students and also all our viewers watching this session. So in this particular session, we will talk about substance abuse, prevention, risk factors and psycho-educational aspects. And to enlighten us more regarding this topic, we are joined by two experts. Let me introduce them to you. We have with us Dr. Rajiv Ranjan. Namaskar, sir.
Namaskar, madam.
Welcome to this session. Sir is a faculty at RIE NCERT, Ajmer. We also have with us practicing counselor, Ms. Pragya Singh. Namaskar, ma'am.
Namaskar, ma'am.
Welcome to both the panelists. Welcome to all the viewers who have connected with this particular session of SAHYOG. Viewers, throughout our live interaction, if you have any of the questions, feel free to reach out to us in the comment section of NCERT official. Besides, you may note our contact number flashing on your screens. It is 8800440559. If any of your queries still remain unanswered, so here is our mail ID. Feel free to write to us at sahyog.ncert@ciet.nic.in. So let's quickly begin this discussion on substance abuse prevention, risk factors and psycho-educational aspects. Here I would invite Dr. Rajiv to tell us more about what actually is the definition of substance abuse.
Thank you so much, ma'am. Thank you so much to all the viewers who are here watching this program. And first of all, I will say sorry to all the adolescents who have good habits and who are practicing with good habits, who help the society, who have positive attitude towards society, who care for self. So I should say sorry to them because they do not belong to this area, substance abuse, and our society is always grateful to those adolescents of India, those students of India. We are proud of them. Regarding substance abuse, but there are few adolescent children, unfortunately, sometimes in the society, they indulge in this process of substance abuse. Substance abuse can be seen in two ways, but the common thing is any substance, if you use, it will abuse you ultimately. So those substance, when we are using it, it is ultimately abusing us, and there will be a harmful or negative effect on the body and mind. तो इस कंडीशन में हम दो चीजें होती हैं. एक तो ये है कि सब्सटेंस ही है, आप डायरेक्टली जब लेते हैं और वो आपके लिए अवेलेबल होता है and it is harming your body and mind. Another thing is the substance has the right use, like medication. There is some medication which is meant for the heart disease or kidney, but a child or adolescent is using it unfortunately, and it is in his habit. So it is going to abuse. A simple soil, sand or something like iron or coin, if you are taking it or keeping in the mouth, it is harming you. It is not made for that purpose to eat, but you are taking it unfortunately, and that is also abusing your body and your mind. So try to understand, one thing is use any substance in a right way which is meant for it. Another thing is protect yourself from those substance which is harmful for you, which is available in the society, which is easily available in the society. Another thing is addiction is here. Addiction refers to, or the addiction comes when you are not able to avoid particular substance, and it is going to harm your nervous system, it is going to harm your body, it is going to harm your mind. And ultimately, when the child or the person try to avoid it, to stop it, there are withdrawal symptoms. You cannot, and it is difficult for you to avoid it. So that's why at the chance of addiction or at the level of addiction, you are not able to stop it, but even you are willing it. Another thing is, if we see different types of substance are there, and which is there, either it is alcohol, we can see it on next slide. There are various types of substances are there, which can be tobacco, alcohol, opioids, different ways of taking the substances. So either by inhalation, either you are consuming it, either it is you are taking in a liquid form. So there are various types of substance, and it is harming ultimately your nervous system. Madam Simran.
Thank you so much, sir, for apprising our viewers about substance abuse, the kinds of substance abuse. Now, here is a need to know about the risk factors associated with that. Pragya ma'am, would you like to answer that?
Absolutely, ma'am. And this is a wonderful question because, like Rajiv sir said, uh, addiction has its roots stem in adolescence only, and that is when most of the people become addicted. And in the same way, adolescents use drug for the same reason for which adults do. That is to change how they feel, as they want to feel better or different. So the more risk factors an individual has, he or she has greater chances that taking drugs can lead to addiction. So if we talk about the risk factor over here, we have some factors which are a little bit more vulnerable in comparison to other. The critical developmental stages in person's life affect addiction vulnerability. Although taking drugs at any age can lead to addiction, but the earlier it begins, there are more chances for more serious abuse. See, if we talk about the biological factor which come first, we have genetic vulnerability. For say the forefathers or fathers have been taking it, so what happens that it get transmitted through genes, and definitely the child is doing passive smoking, so it get transmitted to your genes, and you have a genetic vulnerability. Then there are some biochemical factors as well. There are some secretions of chemicals in your brain, in your entire body, like dopamine and endocrines, everything. So it makes you more vulnerable. There are some neurobiological factors and as well behavioral factors. Behavioral factors are like you did it and you loved it and you will do it again. Then we have some social factors. So since children understand you are susceptible to substance abuse because your level of brain development and thinking, cognitive thinking, and children who are still developing those skills which are needed for wise judgment, good decision and self-control. You are risk takers and don't thoroughly understand the relationship between action and consequences. You experiment, and there is a heavy influence of mass media and peers. So yes, it is the biggest influence. Then of course society and your family is the first school. So we have found children who are there is a parental rejection, or the family is not dysfunctional, and the parents are over or under controlling. We already have some religious factors, like in Hindu culture there are the consumption of bhang, and definitely Christian culture. We have urbanization and poor social support, which affect, and definitely peer pressure. Apart from this, if we'll move to the another slide now, we can see there are some psychological factors. For example, we all know that children are generally rebellious, so this lead them for a major factor. Then there is sense of inferiority complex is there, poor impulsive control, low self-esteem, abuse, inability to cope up with pressure. We have poor stress management skills in those students, in those adolescents, and loneliness is there, unmet needs are there. And understand this, they have a reality from which they just wanted to escape. They just wanted to run from that. So if they have that kind of reality from which they wanted to run, they will try those factors. They will try to experiment. So they have a desire of experiment. They have a sense of adventure and definitely pleasure seeking. And easy availability of drugs. This is my personal thinking that since drugs are easily available, we have drugs prescribed from doctors like benzodiazepine. There are some drugs which they can get without prescription also from chemists, like nicotine and opioids. And there are some drugs that can be obtained from illegal sources. Illicit sources are always there, like street drugs. Over to you, ma'am.
Thank you so much for that great information. Now, Dr. Rajiv, one of the major questions that arises in front of us, we have often heard about it, that substance abuse affects the brain, the metabolism of a person's body. So how does it work around? Please help us with that.
Very good question, ma'am. That is the base of this program, we can say. And Pragya ma'am is a fantastic counselor, and she was telling about the self-judgment and decision making. I would like to start कि बच्चों जो भी यहाँ पे जुड़े हुए हैं, आप अगर एक सिटी स्कैन या MRI जो होता है, प्रेग्नेंट मदर अगर कोई होती है तो उनका अगर किसी डॉक्टर के रिपोर्ट में देखेंगे, अगर आप अल्ट्रासाउंड का अगर 3.5 मंथ्स के बाद और 4 मंथ के बाद अगर प्रेगनेंसी का अल्ट्रासोनोग्राफी का अगर आप वीडियो देखें, उस टाइम में आपको पता चलेगा कि जो स्कल पार्ट है उस टाइम में हाफ स्कल जो पार्ट है वो 40% होता है। मतलब साइज देखें आप तो बाकी बॉडी की साइज बच्चे की जो होती है वो 60% और 40% स्कल होता है। इट मींस व्हाट, गॉड जो है सबसे पहले बिगनिंग में एक स्टार्टिंग से ही he tries to develop the brain, try to understand brain development is a huge process, बहुत ही complex process है जो it is not an easy task to develop a sound brain for us, and it goes from the neuronal tube the first day of the pregnancy, first moment of the pregnancy till 18 years of age। बाद में मैं क्या ऐड कर रहा हूँ, 18 years of age। So brain is developing till 18 years of age। It means कि 18 years तक आपके brain completely develop नहीं होते, still in the process। So that's why आप जैसे यहाँ पे फिगर में देखेंगे, प्रज्ञा मैम ने हमें हेल्प किया है इसको डेवलप करने में, इस पर्टिकुलर स्लाइड को, and it is under construction, still your brain is under construction। You are not competent, totally competent to be completely developed brain for decision making, for self control, for movement, sensation। It means the fantastic sensory integration is still limited, still you are not able to go for with the complete developed brain। So that's why till 20 years of age still prefrontal cortex are not interconnected। So if it is not interconnected, it means you don't have the complete brain, still you require some time to your brain to develop completely and get the maturity level। That's why your own decision making is affected, that's why your own self control is affected, and in this situation you need some guidance, you need some support also। Thanks, please give thanks to those people around you who facilitate you and you help you for all this decision making and judgment। Thank you, Simran ma'am।
Here when we are discussing about substance abuse, now alcohol is one of the components accompanied by substance abuse. So how does alcohol affect a person, and does it have any negative effects, or what sort of categories does it define in, ma'am?
This is again a wonderful question, ma'am. See, like sir has said, that our brain is completely, it's quite vulnerable at that particular time, at your age. So the thing is this, that the children, you should understand how alcohol attack your brain. First, alcohol affect the forebrain and assault your motor coordination and decision making. You won't be able to decide what to do. And then alcohol knock out your midbrain. Your midbrain portion, and you lose control over your emotions. You won't be able to understand how to behave, what kind of emotion you project. You will be very angry, you will be very, you can say very happy, that you will feel a euphoric condition. So you don't have a control over your emotions, and it will increase chances of blackout. And finally, alcohol batters the brain strength. It affects your heart rate, it affects your body temperature, your appetite, your consciousness. So this is the dangerous and a potential fatal condition. And children, it can kill you. This is really very serious. And we can look into this picture on our screen. So just understand this, it affects entire body. It can give you memory loss, it can lack on your concentration, it can give you heart rate, it can give you heart failure, it can increase your heart failure, you can have a hypertension, and definitely it helps your erection problem also. You can become impotent because of it. And there are some, like Rajesh sir said, it impact on the central nervous system. So how it will give you numbness, it will give you neurosis, it can also give your, it can also damage your nervous tract. And definitely you have a bloated skin, your stomach, it will be overweighted, you can have a cancer related to that particular area, like a stomach cancer, colon cancer, beer belly, and you will get a fatty liver with the consumption, because liver has been hit the most with the alcohol. And after that, since you consume it with your throat, then you can have the risk of cancer in your oral cavity, larynx, and throat. Over to you, ma'am.
Yeah, so one of the major questions that arises in front of us is that parents, they set a good example in front of their kids, children, per se students as well. So some of the students claim that, or they try to justify that when my parents are smoking, why can't I? And also there's a notion going behind that smoking doesn't cause mouth cancer. Regarding that, so Dr. Rajiv, please enlighten us regarding this topic.
Yes, as Pragya was telling that almost all the organs of the body is affected due to alcohol. Similar way, yes, as you were telling ma'am, why can't I smoke? Yes, you can smoke, no problem. But smoking, no problem creates all the problems here. So what happens if you smoke from the mouth from here, but it goes till the brain, it goes up to the brain. The moment you smoke, it goes to your lungs, and in the lungs slowly it goes to heart and it mixes with the blood. Once it mixes with the blood, that particular blood containing the nicotine part, it goes to the central nervous system. Once it goes to the nervous system, your total activity is affected. Like if you, either it is body movement, either it is vision, either it is audition, either it is decision making. So everything is abnormal here. So try to understand from the oral part, your gums, your teeth, and your throat, like this oral part, which is your lungs, and then ultimately the different parts of your kidney and liver, all those are in touch with that particular nicotine. And ultimately when blood goes to the nervous system, and when the nicotine is there, what happens? Ultimately your decision making process, your self-control is affected, and slowly the heart disease can come, the disease of the lungs can come up, then there could be vision problem, auditory problem, and ultimately the decision making problem is there. What happens? It was seen that a person who smokes is driving the vehicle. He has to see some vehicle in front of him, and if he can stop the vehicle within 15 seconds, he cannot stop within the 15 seconds. He has to take 22 seconds or 25 seconds. So see the difference. One, you have the capability to stop the vehicle within 15 seconds, but another person who is smoking, he is forced to stop in 22 seconds. So that 7 seconds and 8 seconds is that difference is very much affecting your body and your mind. So in this way, there are lots of harmful effects of the smoking. Simran ma'am.
Yes, sir. As you rightly mentioned that there are harmful effects of substance abuse on the physical appearances and on the physical aspects, physical features of the body. But with that, it also affects or hampers our mental well-being. So Pragya ma'am, please tell us more about it.
This currently, ma'am, this is actually a very relevant topic about the mental health. And yes, see, it is important to understand that adolescents who have substance use disorder may also have mental health disorder, which needed to be treated together such that they can go back to their normal life. And see, addiction is highly stigmatized disease, and it is important to use medically accurate terminology such that we can reduce that stigma. So if we look into that particular, if we talk about the mental health problem, we can have disorders like depression, anxiety, stress, bipolar disorder, and definitely there are some self-injurious behavior, like you can see the lesions, you can see the bruises on the skin of those patients who are consuming it, because they don't feel the pain of it. And definitely you can find the changes in their appearance. There are extreme body modification is there, extreme tattooing is there, and with that it changes your personality as well. How it changes? It changes your impulsivity, it changes your aggressiveness, with negative effect, impairment, it changes entirely. And again, if we talk about your physical appearance, yes, it does. If you look into the picture which we have on the screen, the intravenous, when you will take through your veins, it can give you skin abscesses. The first picture shows your skin abscesses, then you can have cellulitis, the second picture shows the cellulitis picture, and definitely you can have infection, and there are some hypersensitivity reaction which you can see on your next page. In this picture, you can see we have collected few pictures. We have removed the extreme pictures from the viewing. The thing is this, the problem here arises that when you see that your hero is doing it and he is killing bad guys, 10 to 15 bad guys, he is killing it and he is perfectly fine. The thing is this, that is just a fake story that has been shown to you. And it's just a like sort of fairy tale. Nothing happens like that. The picture which you have in front of you, this is the real picture. Within a year, this is how it can give changes to your body. You can change your entire body in a single year. And even with a slight, even a few days, you can get these things. It can spoil your skin. It can give body problems like in your nails, on your toes, on your palate. The third picture shows it's a mouth cancer. See how it has eaten your entire upper palate. It has taken everything from you. And definitely we have eye infection is there, and the nail can turn blue and it gets swollen. All these symptoms are there in front of us, ma'am. Over to you, please.
Yeah, ma'am, very rightly mentioned. As we are approaching towards the culmination of the session, Rajiv sir, we would like to know about the strategies through which we can prevent substance disorders in adolescents.
Yes, this is very important part of this. We can see on this next slide that I have presented. We have presented that there should be a planning. The thing is, we need to understand that if we are going for this strategy, how it is affecting the child. I think another slide after you can change the 2 slides from here, because there are important things which is presented here. See, there are 2 things. Important thing is prevention. How to prevent family members, teachers, peer groups and society. The role of these 4 class is coming here. Peers are such who can put a lots of change in their friends. If the friends are there, if try to change the behavior of their own friend, they can take little bit pain and they can change it immediately. At the part of prevention, what happens? The parents and teachers has to understand the emotions and changes in the adolescent. What happens? Zen society, either we accept it or not, we are losing the capability of understanding the emotions of the adolescents. I am telling, it's not that adolescents are changing the day nowadays. And earlier the adolescents were good and now adolescents are not good. It's not like that. The thing is, two important factors which I need to present here. One is, slowly we are losing that capability of understanding the emotions of the adolescents, and another thing is, we do not have time to help them and come out with the help. We are not understanding and we are not getting the opportunity. Why we are not getting the opportunity? Because we don't have enough time to be with them. So that is very much important. Awareness program is important, mental health awareness program is important, and even the people associated with this in the society, either it is teacher, either it is community people, all has to conduct the training program, awareness program continuously, and then we can come up with the strategies. Over to you, Simran ma'am.
Thank you, sir. Very quickly, Pragya ma'am, we would like to have your response on how to psycho-educate parents and families, teachers out there.
Sure, ma'am. One thing which I wanted to say, that people with substance use or alcohol use disorder are viewed as they are weak, or they have a habit from which they cannot get rid of. But this is wrong. They can overcome from substance use disorder. And the first step to identify substance use in adolescence is to recognize some of the warning signs as soon as possible. Parents and all adults who interact with them should be aware of these signs. And these signs can be symptoms of other mental health disorder also. What you have to do, you should have an open and honest conversation about what is going on from your kids. There should be interaction, that physical, psychological and social complication of drug and alcohol use, they should be aware of it. Psychoactive substances may alter a person's mood, perception, consciousness and behavior. And one thing is important, that family should understand that the patient may use denial, lies or manipulation to control drug or alcohol use, such that he can avoid those treatments. And also, drug overdose and withdrawal can result in medical emergency. They should be aware of it. They should keep a track of it. And one thing which I wanted to say to a student that you should be aware of that sharing dirt or used needle can result in a life-threatening disease like AIDS and hepatitis B. So whatever you circulate with your adolescents, one thing it's very important to understand that those symptoms can be subtle and don't exist until the substance use is more problematic, and parents should not feel guilty about it if they have missed that sign. But understand this, that first message that adolescent should receive is that no matter what happens, you are going to be with him or her. Over to you, ma'am.
Thank you so much for apprising us that acceptance is the first thing that comes to our minds, whether it's parents, teachers or the families, acceptance of what the child is and then trying to help them out. Thank you so much, Ms. Pragya Singh, for being with us in this discussion. Thank you, Dr. Rajiv Ranjan.
Thank you so much.
We would have loved to continue the discussion, but due to paucity of time, we have to wrap up this session here itself. Viewers, thank you so much for being with us in this session of SAHYOG. Stay connected to NCRT. Namaskar.
Thanks to you, ma'am.
Thank you.